It often begins in the quiet moments of an ordinary day. Perhaps you are pulling on a shirt, the fabric grazes your skin, a strange, sensitive jolt that feels out of place. Or you awaken from sleep with a peculiar ache on one side of your back. You dismiss it as sleep or an awkward position. It's not a sharp pain like a cut or a bruise. Instead, it's a whisper, a subtle, persistent discomfort with no clear cause, a faint tingling, a low-grade burning, an itching deep beneath the skin that scratching won't fix. Your skin still looks normal, no redness, no swelling, no rash. You run your hand over the area, find nothing, and shrug it off. You tell yourself it's a pulled muscle from gardening, or stress showing up in your body, or an annoyingly tight waistband. That reasonable logic can be misleading, delaying recognition of an important early warning. This quiet, baffling feeling is often the very first sign of shingles, the prologue to the painful, blistering rash to come. Recognizing it early matters. It gives you a window to get medical advice and start treatment. The initial sensation of shingles can be difficult to describe. It varies from person to person, but it shares a few key characteristics. Many describe it as a tingling feeling, almost like pins and needles. For others, it manifests as a persistent, deep itch. No amount of scratching helps. A common description is a burning or stinging sensation, like a mild sunburn but without visible redness. It can be constant, a low humming discomfort, or come and go in sharp shooting waves. It might feel raw and tender, exquisitely sensitive to light touch. Even clothing can irritate. What truly sets it apart is location and pattern. It almost always appears on only one side of the body. Left side, right side. It does not cross the midline. The virus travels along a specific nerve pathway, a dermatome. The symptoms stay confined to that band. Most common, one side of the torso wrapping from the back, chest, abdomen. Also possible on the face, scalp, arm, or leg. Compare. A pulled muscle is deeper and worse with movement. Pre-shingles feels surface level or nerve-related, present even at rest. Unlike generalized allergy with random patches, shingles is contained to one dermatomal band. If you feel burning on your left shoulder blade, you will not feel it on the right. That one-sided pattern is the key clue. To understand why shingles begins with this strange, invisible pain, you have to go back in time, often decades, to a childhood bout of chickenpox. Chickenpox is caused by the varicella-zoster virus. After you recover from that itchy, spotty illness, the virus is not completely eliminated from your body. Instead, it retreats into the nerve cells near your spinal cord and brain, where it lies dormant for many years. Your immune system acts as a guard, keeping the virus locked away. Shingles occurs when, for some reason, the guard is distracted and the virus reactivates. This can happen due to advancing age, significant emotional stress, an illness that weakens your immune system, or certain medications. Once reactivated, the virus begins to multiply and travels along the nerve fiber toward the surface of the skin. The virus irritates and inflames the nerve from the inside, long before any visible skin changes. The pain, tingling, and burning you feel are direct messages from this irritated nerve. Your nervous system is sounding an alarm. Distress signals travel to your brain, which you perceive as pain, itching, or other odd sensations in that nerve's skin patch. That's why the discomfort is localized and band-like. It maps the territory of a single inflamed nerve. Only after the virus reaches the nerve endings in the skin does the classic blistering rash erupt. The early pain is neuropathic, like a faulty wire throwing sparks, before the visible short circuit appears on the skin. The single greatest risk factor for developing shingles is having had chickenpox. If you have never been infected with the varicella-zoster virus, you cannot get shingles. Most adults today carry the dormant virus. Risk climbs significantly after age 50. About half of cases occur at 60 and older. As we age, specific immunity wanes. Immunosenescence makes reactivation more likely. An 85-year-old is far more likely to have shingles than a 35-year-old. It reflects a lifetime of diminishing viral surveillance. Beyond age, immune-weakening conditions or treatments markedly raise risk. HIV, leukemia, lymphoma, organ transplant with immunosuppressants, chemotherapy, radiation, and long-term or high-dose steroids like prednisone can lower defenses. Significant physical or emotional stress, major life events, chronic stress, surgery, or trauma may provide an opening for reactivation. Still, shingles can occur in young, healthy people without clear triggers. The virus's reawakening is not always predictable. The presence of the virus is the fundamental risk. Knowing your risk helps you act fast if those one-sided band-like sensations appear. If you begin to experience that characteristic one-sided tingling, burning, sensitivity, your first response should be calm observation and gentle care while you prepare to contact a doctor. Reduce friction on the affected area. Choose loose-fitting, soft, natural fabrics like cotton. Avoid tight waistbands and restrictive straps. Avoid synthetic materials that trap heat. Let the area breathe. Apply cool, damp compresses. Soak a clean washcloth in cool water, wring it out, and lay it over the area for 15 to 20 minutes several times a day. Use a fresh cloth each time. Gently pat the skin dry. Do not rub. Try a cool bath or a colloidal oatmeal bath. Avoid hot water. Heat intensifies nerve pain. For discomfort, consider over-the-counter pain relievers, acetaminophen, ibuprofen, or naproxen. Follow package instructions and check for drug interactions. They won't stop the virus, but they can improve comfort in this phase. Monitor your skin closely and check several times a day. A rash often appears 1 to 5 days after the pain starts. It begins as small red bumps that can quickly become fluid-filled blisters. Note when the pain started and when the first spot appeared. That timeline helps your doctor. Don't wait too long. These remedies are for comfort while you arrange a professional diagnosis. Plan your appointment as you care gently for the area. Recognizing the early signs is only half the battle. The other half is acting swiftly. Contact your healthcare provider as soon as you suspect shingles, especially once a rash appears. The ideal time to see a doctor is within 72 hours of rash onset. Antivirals are most effective in this window. Starting early can reduce rash severity, lessen pain, and lower the risk of postherpetic neuralgia. If pain and rash are on your face, particularly near your eye or on the tip of your nose, seek immediate care. Risk of serious eye complications. Do not wait for an appointment. If you are severely immunocompromised, due to cancer, HIV, or transplant medications, seek urgent evaluation. Other red flags: extreme pain unrelieved by OTCs, dizziness or confusion, rash spreading beyond one band, fever and headache. When you call, be direct. Say, "I have a painful one-sided rash and I think it might be shingles." The word shingles signals urgency. Waiting to see if it improves is a gamble you don't want to take. Acting on day 1 versus day 4 can significantly affect recovery and long-term well-being. Diagnosis is usually clinical. Your doctor can often confirm by examining the rash. Antiviral medication is the cornerstone of treatment. Acyclovir, valacyclovir, famciclovir. They don't kill the virus, but they prevent it from multiplying, helping your immune system gain the upper hand faster. This speeds healing, reduces new blisters, and shortens the illness, most effective if started within 72 hours of rash onset. Pain management is essential. Mild to moderate pain, acetaminophen or ibuprofen. More severe pain, prescription options such as antidepressants, anticonvulsants, or a short course of corticosteroids. Rarely, brief narcotics. Keep the rash clean and dry. Avoid picking or scratching. A non-stick sterile dressing protects from friction and limits spread. Blisters may weep, then crust and scab. Let scabs fall off naturally. Topicals like calamine can soothe itching. Rest matters. Plan follow-up to ensure proper healing. If pain persists for months, it may be postherpetic neuralgia. Your doctor can offer treatments such as medicated patches, creams, or nerve-modulating medications. The most effective way to protect yourself from shingles is vaccination. Shingrix, a non-live vaccine given in 2 doses spaced 2 to 6 months apart, is highly effective, over 90% in adults 50 and older. It's recommended even if you've had shingles to help prevent recurrence. It boosts specific immunity that may have waned with age. Health authorities recommend Shingrix for healthy adults 50 and over, regardless of remembered chickenpox history. Even if you had Zostavax, get Shingrix for stronger, longer-lasting protection. Talk to your doctor or pharmacist to schedule doses. Beyond vaccination, maintain a strong immune system. Manage stress, practice mindfulness or meditation, do gentle yoga, spend time in nature, eat a balanced diet, fruits, vegetables, lean proteins, whole grains, to supply key vitamins and minerals. Get regular exercise. Aim for at least 30 minutes most days. Prioritize sleep. 7 to 9 hours nightly supports immune repair. If you have conditions affecting immunity, work with your doctor to optimize control. Vaccination plus healthy habits greatly reduces your chance of a shingles outbreak. The journey of shingles often starts not with a dramatic eruption, but with a subtle, quiet message, a strange tingling, a persistent itch, a phantom burning on one side of your body. This early warning is a precious gift, a window of time to act decisively. Ignoring it squanders that opportunity. Learn the signature, confined to one side, often band-like, with no visible cause on the skin at first. Don't wait. Watch and prepare to act. Steps are simple and clear. At the first sign, give gentle care at home, cool compresses, loose clothing. Most importantly, plan to contact your doctor without delay. If a rash appears, call immediately. Start antivirals within the first 3 days. It can mean a milder illness and a much lower chance of long-term nerve pain. Prompt action is powerful medicine. Don't let fear cause hesitation. Shingles is common and well understood. Treatments work, and the vaccine works even better. Ask your doctor about Shingrix if you're over 50. If you feel that subtle pre-shingles sensation, trust your body. Recognize the quiet signs, take simple steps, seek help at the right moment, and face shingles with calm, informed confidence. Listen to the whispers, so you may not have to endure the shout.